Hi everyone. My name is Sarah Avery, and I'm the health educator here at MGH Charlestown Healthcare Center. For today's community Zoom, we have Sue Ellen Briggy and Patrice Nicholas here with us today from the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health to discuss heat-related illness, who is at risk, and simple ways to help you and your family stay healthy and safe while you enjoy the summer season. If anyone has any questions through the presentation, please submit them to the chat and I'll ask them to our presenters in the end. Thank you. I'll hand it off to you, Sue Ellen and Patrice.
Thank you, Sarah. Thanks for having us be here to provide some education to the community about heat-related illness. We appreciate it. I'm here, so my name is Sue Ellen Briggy, and I am a faculty member in the School of Nursing at the MGH Institute of Health Professions, which is located right here in Charlestown. And I'm with my colleague, Patrice Nicholas, who's also on faculty in the School of Nursing and who is our director at the Center for Climate Change, Climate Justice, and Health. So we wanted to talk a little bit about ways to stay safe this summer, and particularly to talk about heat-related illness, because injury and death related to heat is preventable. And so really knowledge is power, and getting that knowledge out there to people can really mitigate the impact that heat can have during the summer months. And it's a preventable injury with that proper knowledge. So summer is almost here, and if you are listening to this recording, today is Tuesday in May, and it's a beautiful day. It feels a lot more like mid-June, but it's great, and it feels good to have the warm sun on us. But we also have to remember to take precautions to be safe. So as Sarah mentioned, we're going to talk a little bit about heat-related illness, considerations if you have a chronic medical illness, and we'll also talk about a few other conditions that are related to heat and that can be exacerbated by heat as well. So this is data looking at the number of hot days we had in 2019, which at this point was 2 years ago, and then the projected number of hot days we're going to have by 2050. And this visual just, and these are days above 90 degrees. So this visual just really shows you where we're headed and why this topic is important. And when we think about heat and we think about hot days, that old saying, it's not just the heat, it's the humidity, really rings true. And so what this chart shows is the difference between a high temperature day and then the impact that relative humidity has on what it feels like the temperature is, or how humidity impacts the way we perceive heat. So if you look, for instance, and if you think about it, you can think about it like this. If you think about a place like Arizona, they usually have a dry heat. If you think about a place like Florida, they have more of a humidity, like a wet heat. And we have a mixture of both, but we certainly have those hot, muggy days in the summertime. So if you look at this chart, you can see it shows you not only how humidity impacts heat and temperature and how they combine, but you can see that the danger zone, as the relative humidity goes up, shifts over to the left, meaning it becomes more dangerous. So the higher the relative humidity combined with a temperature increases the perception of that temperature. So, on a 90-degree day, if the humidity is low, it might feel like 91. If the humidity is high, it could feel as high as, it will feel hotter. So, that old adage is correct. One of the other things that contributes to the way we experience heat is something called the urban heat profile, island profile. And so Charlestown is actually an urban heat island. So what this means is that because there's less green space, so there are less trees to absorb the heat, and there's more asphalt, and buildings are closer together, and even air conditioning, while it's important for hot days, also generates external heat. So these things all raise the temperature within urban areas. So if you're in a rural area, or you're in a suburban area, or you're in places where there's more green space, it will be cooler. And so this is also an important consideration. This information comes from the CDC. In the United States, on average, there are 702 heat-related deaths each year. And remember, I said that these are, for the most part, these are preventable with the right interventions and precautions. There are, on average, 65,574 emergency room visits due to heat, and roughly 9,000 people are hospitalized due to heat. So those are pretty significant numbers. And when you think about heat-related deaths, this includes things that are directly related to heat, like heat stroke, which is a medical emergency, but it also includes things like related to cardiac disease, pulmonary disease, and cerebrovascular disease. So who is at risk for heat-related illness? Infants and young children, people 65 years and older, particularly elderly people or older adults who are isolated socially, people who are overweight, people who work outdoors for a living, like construction workers, or even firefighters in the summer if they're having to wear a lot of gear on a hot day. Farm workers are at risk. Athletes are at risk, particularly if they're training on these really hot days. And a lot of schools have actually created guidelines around this very issue, because heat stroke and heat exhaustion are very real problems for athletes as well. Pregnant women are at risk from heat-related illness, and this is one area that people might not realize, that pregnant women are at risk. And the other thing that I should mention, when we talk about the heat and the humidity, also think about you combine those two things with poor air quality, and that also really exacerbates the problem. So pregnant women are at risk, and this can also be harmful for their unborn fetus. So because they are, carrying a fetus, they have to really work harder to cool off. Their bodies have to work harder to cool off. And then certainly people who have chronic medical conditions are at risk. So people with heart disease, pulmonary disease, certain medications put people at risk, such as diuretics, which are sometimes referred to as water pills, because you're actually, those medications remove fluid. And so that can increase someone's risk of becoming dehydrated. And in older adults, as we age, we actually lose our thirst mechanism, which is really important to note. So that compounds the problem for older adults, because they may not feel thirsty, and if they're not drinking regularly, then that can put them at significant risk for dehydration. Other medications include medications for heart disease or high blood pressure. Depression, medications for depression can influence risk, as well as medications from insomnia and poor circulation. So, and I'll touch on this later, but if you have a chronic medical condition, you should really discuss ways to stay safe with your healthcare provider. And that would be really important because of those special considerations that have to be considered. So every year there's a publication called the Lancet Countdown on Climate Change and Health. And this is an international publication of people that are looking at all the things that are impacting our health that are related to climate change. And then the United States creates a policy brief. And so this year, one of the areas that they focused on were older adults and heat-related illness. And so they found that in 2019, people over the age of 65 experienced 102 plus million more days of heat wave exposure in the United States compared with the period between 1986 and 2005. And heat-related mortality, so people who died from heat-related illness who were older, greater than 65, has almost doubled in the last 20 years. And again, remember that I said that it is a preventable illness, and it's a preventable, death can be prevented. This brief also talked about occupational exposure. And remember, we just pointed out that this puts you at risk for heat-related illness. But in 2019, 2 billion potential hours of labor were lost due to extreme heat. And so this impacts the service industry, the manufacturing sector, agricultural sector, and construction. And in construction alone, that was 540 million potential hours lost. So I mentioned there are very specific heat-related illnesses that you should be aware of. And the most important one and the most dangerous one is heat stroke. And so for people who are experiencing heat stroke, they have a high body temperature, 103 degrees Fahrenheit or higher. They'll have hot, red, dry skin for the most part, fast, strong pulse. They might experience headache, dizziness, nausea, confusion to the point of losing consciousness or passing out. So if you begin experiencing this, or you encounter someone who has, whether that be a friend, a loved one, someone on the street, the important thing is that you call 911 right away. Because this is a medical emergency and time is of the essence. And the major thing is to cool that person down. And so that means if you have time and you have the ability, you would want to move the person to a cooler place. If you can, you would want to either provide cool cloth or a cool bath if that's an option, but don't give them anything to drink. And when they get to the hospital, that will be the major intervention will be, cooling them down. Heat exhaustion is a little less serious, but still, nonetheless, it's serious, and it could lead to heat stroke if someone's feeling this way and they don't remove themselves from this hot environment. So in this case, there's more heavy sweating, clammy skin, a fast, weak pulse. There can be nausea and vomiting, muscle cramps, a feeling of tiredness or weakness, dizziness, headache, and they could also faint or pass out. Their temperature, the difference will be how high their body temperature has gotten. So, if you think about these illnesses we're talking about, they can kind of occur on a continuum. So what to do in this case is get the person or get yourself to a cool place, loosen your clothes, and then really just take interventions to cool yourself down, whether that be a cool bath, a cool shower, wet cloths on your body that are cool. And if your symptoms don't go away or they get worse, then you seek medical help right away. And these include throwing up, or symptoms lasting longer than 1 hour, because that will mean you need more help getting yourself cool. Heat cramps can also occur. So this could be, typically a typical scenario would be someone who's overexerting themselves. So people might have just gone through heavy sweating, and they may have muscle pain or spasms. So you're going to stop your physical activity, whatever that is you're doing, and get to a cool place. In this case, you do want to rehydrate and drink water. And if you've been doing something really strenuous, something like a sports drink can be helpful, because that actually replaces the salt and the minerals which you've kind of sweated out during that intense activity. You want to get help if your cramps last longer than an hour, if you're on a low sodium diet, or you've had problems. So in any of these cases, even the ones that you may be able to handle on your own, if you have a medical condition, you always want to err on the side of caution and contact a medical provider. And then also you can develop a heat rash. So this is, obviously much less serious, but can be a nuisance, and you want to address it and take care of it. And this, what you would find would be like little red clusters of blisters that look like little pimples, usually in the neck, the chest, the groin, or in your elbow. Keep the rash dry, stay in a cool place. A lot of the interventions for this, the major intervention is, one, prevention by not going out when it's really hot, but then two, getting out of the heat and, taking measures to cool down. So as I just said, you really want to try to do everything you can to stay cool and beat the heat, as we said. So on these hot days, you want to wear lightweight clothing, light colored loose clothing. And a lot of these things I'm sure you're familiar with, but there's some things that you might not be. And so I didn't want to pick and choose. So some of this might seem very evident to you. You want to stay indoors during the time when it's the hottest. So the best time to go out is, earlier in the morning and in the evening when the sun goes down. The worst time to go out is during, that mid-morning to mid-afternoon when the sun is the strongest. If you have the ability, air conditioning is an option that you should certainly consider. If you don't have the ability to have air conditioning, you can always, if possible, you can go to a place that is air conditioned, for instance, the mall or the library. And then there are also cooling centers in your area, and you can find those out through either your local healthcare provider or, by calling the city of Boston. They'll be able to tell you which cooling centers are open this season and where they're located. And cool showers and baths are always helpful, just to keep us cool on those hot days as well. You want to stay hydrated and eat light meals. And remember, I mentioned as we get older, we lose our thirst sensation. And so for older adults, it's really important to drink on a regularly scheduled, a regular schedule. You want to avoid or limit alcohol and sugary drinks, because these can be dehydrating. As I mentioned, sports drinks are a good source of salt and minerals. And I threw in here, and it's funny because we were just talking about our pets, but you don't want to leave your pets out of the equation either. You want to make sure that they're not out in the heat, and you want to make sure that they're well hydrated and have plenty of water as well. And I'll just reiterate that if you have a medical condition, that you really need to have a conversation with your healthcare provider about what will work best for you, particularly around how much you should be rehydrating or hydrating, in case you have a fluid restriction, and whether you or not you should be drinking sports drinks. So and also you can get recommendations from them around other medications that you are on that you should be considering. But that all goes through your healthcare provider, certainly. So, and by the way, this information comes from a little tip sheet from the Centers for Disease Control and Prevention. And so one of the major things that they say is like people need to know signs and symptoms of heat-related illness, which is why we're here talking to you today about this. Keep informed by checking your local news for extreme heat alerts, safety tips. They also usually will talk about cooling center locations, and watch the weather forecast to stay up to date. And as I mentioned, elderly people who are living alone or are isolated are really at risk. And so if you have an elderly neighbor, check on your neighbors to make sure they're okay during this time as well. The one thing that I did not mention, and I'll mention it with a caveat, is that, we talk about the importance of air conditioning. Even though it can be a heat generator in the external environment, it's good for us to have to stay cool. Fans are good because certainly they circulate the air, but they can actually, in high heat, high humidity days, they can actually be more harmful. So you just need to be careful about that. And other things to do, I don't think I added this here, but on these, when it's really hot, you want to close your shades during that really high sun time, that mid-morning to mid-afternoon, and measures to control the environment and the heat of your home environment. But so fans are fine unless it's a really, really, really hot day with a lot of humidity. So that's pretty much what we had to say about heat-related illnesses and how to prevent those, just as a brief overview. But we also wanted to touch on two other things that impact us around this area that are significant for us living in the Boston area. So one is vector-borne illnesses, which I'm sure most people are aware of, the issues around Lyme disease. We hear a lot about West Nile virus in the news, which is mosquito is a vector for West Nile virus, and ticks certainly for Lyme disease. And then some threats to water safety, particularly what they call harmful algal blooms. And we'll just touch on these because they prevention is really important to kind of addressing these issues and staying safe. So this shows you, this shows Lyme disease distribution in 2001 versus the distribution in 2018. And while you can see that these are not on the same scale, I think what you can see is that the Lyme disease has expanded. It's expanding kind of like and becoming more concentrated, not only in Massachusetts, but it's kind of expanding toward the west and a little bit to the south across the United States. But definitely the concentration has become much heavier in the Northeast United States. And that was 3 years ago. So I'm sure if we had more recent data, I'm sure that would be even more concentrated. This is a little bit busy, but I think it's important slide. So this is the rate of Lyme disease among males and females, and then the ages that are most impacted. And so the further out these lines go, to the right or to the left, you can see those are higher rates in that age category. So what this is really showing is that at the top here, the rates are high among kids 5 to 14, more in males than in females, which makes a lot of sense because they're outside a lot. And then adults, pretty much like 55 through like 79 range. And again, more in men than women. So this is just kind of a visual to say it's really important. It's important for everyone to protect themselves, but it's also, you know, if you have young kids at home, you have to think about protecting them. And if you're in that age range, in the adult age range, you just have to be careful and really diligent about protection. This is that bullseye rash that if you get bit by a tick, this is generally what happens if you've been infected with the tick that has Lyme disease. So you can see like the center on each of these bites is red and concentrated. And then it's more difficult to see, as you can see on darker skin, but the bullseye is that there's a kind of a lightening in the middle here, and then another concentrated rash on the outer surface. So this, whether or not you have other symptoms, you should call your provider and seek medical attention, because they'll put you on antibiotics, and that will hopefully prevent you from getting Lyme disease. So in addition to the rash, you may experience a fever, just a feeling of exhaustion, or joint and muscle aches within weeks of removing that tick or being in a high tick area. So it's really important to do tick checks. And if you see anything that looks like this, then you call your doctor and you get seen right away. So prevention is really key. And this just shows you, and one of the things with Lyme disease is, these ticks can be really, really small and hard to detect, which is why doing a good tick check after you've been outdoors is really important. But in addition to that, using an insect repellent when you go outside. Now, I listed everything that they had listed on the CDC website, but basically, something that has DEET in it is really effective. And I do know people who have used this lemon eucalyptus oil. Those seem to be two of the more common insect repellents that people use. If you're going into a really wooded area, you want to wear clothing that's treated with permethrin, and a lot of like hiking clothing has permethrin in it to avoid tick bites. Shower as soon as possible. I mentioned tick checks, particularly armpits, behind the knees, your hair, and your groin. And I'll also add, don't forget your pets with the tick checks either. And put clothes in a hot dryer for 10 minutes after you've had a significant exposure to an area that's a high tick area. And then lastly, excuse me, I wanted to touch on harmful algal blooms, because these now, I'm not sure, a few years ago in the news, there was a pond in Arlington where people take their dogs and whatnot, and a couple of dogs died because they went in this water, and the water had these, I'm going to call them HABs because it's less of a tongue twister, which is also known as like a blue-green algae, but it can also be like a red tide. So these HABs are caused by like quick and significant proliferation of cyanobacteria. So that bacteria is found in water, all types of water. But if it's, especially because our oceans and our water sources are more warm because we're all experiencing warmer days in general, and a warmer atmosphere, what happens is between the warmness of the water and nutrients like a fertilizer or septic tank runoff. So this creates nutrients and the right environment for these bacteria to just kind of grow and expand beyond what's appropriate. And if it's a kind of bacterial strain that produces these cyanotoxins, then it can be harmful because they actually cause like neurotoxicity. What you don't know is which algal blooms are harmful. So some might be and some might not be. They're not all harmful, and that's kind of creates a kind of a extra need to be careful. So and you've probably seen these. They can look like scum on the water. They can be foamy. They can be different colors. They can be oceans. They can be in lakes. They can be in rivers. They can be in ponds. So you want to, if you see these, you don't want to let yourself, your kids, your pets in that water. So if it's green, don't go in because it can be harmful. And like I said, you don't want to let your pets in there. So, and again, this might be something that people are aware of or they're not aware of. I think it was like, I think that it's a good thing to know because, as I mentioned, people's pets died a few years ago, and it might have been that people weren't aware that these can be so harmful to kids, adults, and pets as well. So that's kind of our brief overview that we wanted to present on just ways, and what I didn't put in here, which is like the obvious one, obviously, is wear your sunscreen, and try to, and again, is prevent any kind of sunburn, which can also be a heat-related illness, I guess, right? So we just wanted to provide a general overview to people as a means to hopefully increase people's awareness about heat-related illness and some other things that are impact us in this area, this region, and hopefully spread the word and stay safe this summer. Patrice, would you like to add anything? You're on mute.
Thank you so much, Sue Ellen, for that really comprehensive overview and very, very helpful information for the entire Charlestown Health Center community. I'll add that, first of all, migrant farm workers who are here in the Northeast and close by our Charlestown community are at risk of heat stress because of that slide Sue Ellen presented with the combination of high heat and then adding in humidity. In areas like Florida, they actually are trying to adjust migrant farm workers' work days so that they are not out in the high heat and humidity at noontime and beyond. Often they go to work in the dark and have auxiliary lighting so that the workers work and pick crops starting, for example, at 4 o'clock in the morning so that they end their workday at 11 or thereabouts prior to the extensive and amplified heat that they experience. So that's number one, but that's particularly necessary even here in the Northeast and around our Charlestown community. Another example of occupational heat stress, I live in Charlestown. We had a painter working in the exceedingly high heat last summer and the summer before, up on a ladder. I brought out water for the person, for people, and the person had 2 drinks with him, but that really wasn't enough to get him through the high heat. And he was still working at noon and 1 o'clock and 2 o'clock on a day of high ambient heat, high heat temperatures, combined with a very humid day. So it's important to think about our roles as health professionals, but also living in a community. Health education, we all have a responsibility for that, whatever our roles are at the Charlestown Health Center. The other thing I wanted to just amplify, thank you, Sue Ellen, for the Lyme disease piece, is that Spalding Rehabilitation Hospital has the leading post-Lyme disease treatment clinics in the world. And Lyme disease, as Sue Ellen shared, is expanding rapidly. And we have right here in our own backyard, the leading center for post-treatment Lyme disease, whereby some people may not have gotten antibiotics and been appropriately treated, or they may have gotten antibiotics, but perhaps they were already in a situation of late diagnosis that then really requires an additional layer of following those patients that would require perhaps referral to Spalding's clinic. So thanks, everybody, and thank you, Sue Ellen, for leading this impressive session.
Thank you both, Patrice and Sue Ellen, for coming together to share this information. That was really great. Does anyone have any further questions beforehand? Or Patrice and Sue Ellen, do you have a suggestion or a link or a name for where people can reach out for more information on this?
The CDC website has, if we were able to do this in person, they have great little like community education pamphlets that are easy to read and understand for lay people. The city of Boston has, information about heat related issues. I think those are two great resources.
Mm-hmm. And I'll second what Sue Ellen just shared. The Centers for Disease Control and Prevention are really high level for health professionals, but the health education materials for lay people are extraordinary. I recently offered a presentation about the importance of the HPV vaccine. And I heavily utilize the Centers for Disease Control and Prevention and their layperson materials for clinics to distribute, for example, like the Charlestown Health Center, are impeccable. They're really, really helpful about the age range of why it's important at 11 and 12, how many doses of that the vaccine need to be given, what happens if you miss giving the vaccine, and at what age range is it not even preventive any longer. So to Sue Ellen's point, the Centers for Disease Control and Prevention for lay health education materials on climate change and lots of other health conditions are really, really impressive.
Thank you both so much. And thank you all for coming here today.
Thank you.